I have not gone public ever, and not very many people even know the cause of Stephen's death, because I do not want to be the poster child for the anti-vax movement.
Stephen McDougall was 45, a father of two with an entire life ahead when he died.
Myopericarditis post-COVID vaccine.
His widow, Kimberly, was told a new federal program would help people financially if they were seriously and permanently injured. The Vaccine Injury Support Program, or VISP.
It's like a lottery, right? You never think it's going to be you.
The government hired an accounting and consulting firm, Raymond Chabot Grant Thornton, now called Oxaro, and paid them tens of millions of dollars to run VISP. But Global News spoke with vaccine-injured people and former workers across the country who say that program is chaos. Unskilled staff running a system unequipped to handle thousands of claims, leaving the injured waiting months, sometimes years, for help.
It got to a point where everything was a battle.
After 11 months, VISP approved Kimberly's claim and paid a death benefit worth roughly 3 years of Stephen's former salary, the maximum amount allowed by the Public Health Agency of Canada. And while VISP claims it will continue to support you for as long as needed, for Kimberly and her children, that meant only offering to pay for enough therapy to cover weekly sessions for a little over 3 months.
And then my kids are supposed to be fine. I'm supposed to be fine.
When COVID hit, Canada was the only G7 country without a vaccine injury support program.
We kept telling people, you don't want to stand these things up right in the middle of an emergency.
But during a pandemic,
we're creating a federal support program.
That's exactly what happened.
What we saw from global experiences, things don't go great.
And they didn't.
Thank you for contacting the Vaccine Injury Support Program.
Shannon DuPont's claim was approved.
To speak to a dedicated case manager.
And yet 4 years later, she's still battling VISP. With each of her 3 COVID shots, Shannon's health got worse. Vision loss, an autoimmune disorder, Bell's palsy.
My face literally looked like it was melting off on one side.
Unable to work, VISP said it would pay for her lost income and some of her injuries.
I'm on case manager number 9.
But error after error, she says.
They seem to lose everything and then you start all over from scratch.
Has left her $180,000 short.
I definitely cashed out every investment I had. I actually remortgaged my house.
Since 2021, the federal government has paid Oxaro $50.6 million to run VISP. Only a third of that, $16.9 million, has reached the injured.
So where's the money going?
In an email, Oxaro said it aims to provide a process that ensures all cases are treated fairly and with the same care, respect, and due diligence. It says its invoices reflect actual costs, reviewed and approved by the Public Health Agency of Canada. As for its timelines, it says that depends on each claim's nature and complexity. Stephen McDougall's widow says he would have still believed in science, although she no longer believes the government is there to help.
They promised to take care of us. They didn't fulfill their promise.
The Public Health Agency of Canada declined an interview, but says it's reviewing the program and concerns raised. Meanwhile, the federal health minister, Marjorie Michel, reached out to us saying the allegations we've uncovered are completely unacceptable, that she's asked the Public Health Agency of Canada to find a solution and that all options are on the table. Carolyn Jarvis, Global News.